Hello guys, so this is a presentation that I've prepared in regards to the leading cause of death among Pakistani children and how it could be prevented. So just to start off, the infant mortality rate, they rank about 26th out of all of the countries with mortality rates, and just with Pakistan and four other countries combined, they are responsible for about half of all deaths of children under the age of 5. And this isn't just the children that die, but also the mothers during childbirth. There is a constant uh, high rate of death when it comes to mothers giving birth, especially in the rural areas of Pakistan, due to lack of resources. If I'm not mistaken, there's a female mother who dies every 17 minutes in regards to childbirths in Pakistan. So the main cause of deaths of infants in Pakistan, as well as young children, is disease. So there are about 400,000 infant deaths per year due to disease, and 7 million cases of pneumonia, just pneumonia itself, every year in Pakistan. Um, so almost 1 million of children die under the age of 5 from pneumonia itself. Pneumonia being one of the second or third leading causes of deaths in Pakistan. And Pakistan, out of 15 countries that hold 75% of those 1 million deaths, Pakistan is the third highest. So it has a really high rate of deaths regarding children who pass due to pneumonia. So there was a university, Aga Khan University, that did a case. They did a study to see the leading causes of death for the children in Pakistan, and they did this in the area of Karachi, Pakistan. It was done by Muhammad Imran Nisar, Muhammad Ilyas, and Fiyaz Jehan. So they were able to see that out of 833 neonatal deaths and 591 under age of 5 deaths, that is past that neonatal stage, which is a newborn, were identified, and out of those, the leading common diseases that cause the deaths were perinatal asphyxia, neonatal sepsis and meningitis, as well as preterm birth complications and neonatal pneumonia. For the neonatal deaths, as well as from that newborn stage, and the post-neonatal deaths, which is after that newborn stage, up until the age of 5 or less. The leading causes were sepsis, diarrheal disease, pneumonia, and meningitis. So as you can see here, 42% are the after the neonatal stage, which is after that newborn stage. You can see that they are about 42%. There's 30% of the perinatal asphyxia, and then about 28% of the rest of the diseases during the neonatal stage, which is during that newborn child age. And you can see right here the pneumonia, diarrheal, and sepsis having the largest amounts, and the rest are either due to malnutrition, disease, or being injured. Right here we have Dr. Salma Shaikh, who has been studying and doing pediatric care for 30 years, and she was the one who was able to discover the 400,000 infant deaths, as well as the 7 million cases of pneumonia each year. And right here we have Dr. Ghaffar Bilou, who has done about 500 cases or more of disease, and he was able to see that diarrheal disease is a huge issue when it comes to children under the age of 5, as well as he was able to see a lot of the disease and how it affects children. He was also able to note that because of the conditions in which a lot of the people in Pakistan live, whether it's in the rural areas or just the lack of female doctors, that is what causes the high rate of mothers dying in childbirth, as well as the number of children who die at a young age. And so, really, the issues with why this occurs is because the biggest difficulty is more that the people of Pakistan are not well informed of diseases and how to prevent those diseases. One example that we've seen so far in class is the polio virus. Even though it's not a leading disease that causes death, It does cripple a lot of children, and the reason why is because the people they just don't understand the need for the vaccination. You have organizations like the Taliban that tell people that the vaccination is not good for the children. And so, with people not being able to know how to treat these diseases as well as how to prevent it, that causes a huge infant death rate, as well as with people being in rural areas, a lot of childbirths occur at home. Um, since the mothers can't really go out to a hospital, or they don't really have enough female doctors who are trained to be able to help in childbirthing processes. And so, not only do the children suffer, but also the mothers. Here are my sources that I got regarding the information that I have. Thank you so much for watching, and I hope you're able to get a better insight as to what causes a lot of infant deaths in Pakistan.